Excuse me, Chairperson Henderson, members of the committee, thank you for the opportunity to testify. My name is Gunderson. I'm a senior policy analyst with the DC Fiscal Policy Institute and a member of the Under 3 DC Coalition. Healthcare for Childcare makes free or low-cost health coverage available to childcare workers who live in the district and non-district childcare workers whose employers purchase coverage through the DC Health Benefits Exchange. To date, more than 1,800 educators and their families have benefited from healthcare for childcare, many of whom are receiving employment-based healthcare for the first time. Many educators have testified before the council about how life-changing this program has been for them. And every dollar DC invests in healthcare for childcare nets over $1 in premium value, making it a beneficial program for the entire district. Yet, the DC Health Benefits Exchange recently instituted a waitlist for new childcare facilities enrollment and healthcare for childcare coverage due to insufficient funding. Prior to instituting the waitlist, the Health Exchange enrolled 79% of eligible childcare facilities in healthcare for childcare, a great accomplishment in just a few years. But that leaves almost 60 facilities across the district without access to group coverage through healthcare for childcare and subject to the waitlist unless more funding becomes available and other facilities drop out. The Health Exchange successfully extended healthcare for childcare to the facilities in every ward, but participation varies considerably. For example, Wards 7 and 8 have the smallest percentage of facilities enrolled in healthcare for childcare group coverage. This gap will persist if the budget does not allow for more childcare facilities to enroll in healthcare for childcare. DCFPI is grateful that the Health Benefits Exchange continues to work diligently to ensure that educators living in DC who are at risk of losing Medicaid coverage due to earning higher salaries are pulled into healthcare for childcare for individual coverage. We recognize that their commitment to creating a well-designed healthcare program is one reason why the Pay Equity Fund has been so effective at attracting more educators to early childhood classrooms, increasing the retention of qualified educators, and expanding access to high-quality, affordable care to district families. Their deep commitment to provide coverage to as many facilities, educators, and families as possible has allowed this program to thrive. The Health Exchange also thoughtfully engaged the community and facilities via outreach events and an advisory council, engaged the Under 3 DC Coalition in policy decisions, and kept us updated on critical administrative changes, pulling us in as partners to expand the reach and efficacy of healthcare for childcare. Yet the limited budget for healthcare for childcare is now stymieing progress towards the ultimate goal of early educators having access to healthcare when they choose to work in any district childcare facility. We look forward to continuing to work with the Health Exchange to ensure that they have the resources they need to continue this important work. Thank you, Councilmember Henderson, for your steadfast support of the Pay Equity Fund and healthcare for childcare, and thank you for the opportunity to testify. I'm happy to take questions.